Diabetes isn't simply about eating too much sugar. It's about how your body controls glucose. Normally, insulin helps glucose move from your blood into your cells, where it can be used for energy. In type 2 diabetes, cells can become resistant to insulin, making it harder for glucose to leave the bloodstream. Diabetes is a group of conditions in which blood glucose remains too high because the body cannot produce or use insulin properly. The main types include type 1, type 2, and gestational diabetes, and their causes are not the same. And when high blood glucose continues for years, it can gradually damage blood vessels and organs throughout the body. Type 1 diabetes occurs when the immune system mistakenly attacks the pancreas's insulin-producing beta cells. Type 2 diabetes is usually more complex, involving insulin resistance, genetics, and other metabolic and lifestyle factors. Risk can increase with family history, excess weight, inactivity, age, and certain other health conditions. And an important point, diabetes isn't caused simply by eating sugar once. The risk involves many factors acting over time. When blood glucose becomes too high, some people develop unusual thirst, frequent urination, fatigue, or blurred vision. Unexplained weight loss can also occur, particularly when diabetes is significantly uncontrolled. But symptoms alone cannot diagnose diabetes. Diabetes is diagnosed with blood tests, such as fasting glucose, an A1C test, or other standardized glucose measurements. The real danger often develops quietly. Over time, persistently high glucose can damage blood vessels and increase cardiovascular risk. Diabetes can increase the risk of heart disease and stroke because long-term metabolic changes can damage the cardiovascular system. Small blood vessels can also be affected, putting the eyes at risk of diabetic retinopathy and vision problems. The kidneys are another major target. Long-term diabetes can damage their tiny filtering vessels and lead to chronic kidney disease. Nerve damage can cause numbness, tingling, or pain, especially in the feet, where unnoticed injuries can become serious. Diabetes can be managed, and treatment is tailored to the type of diabetes and each person's individual needs. A balanced diet built around vegetables, whole foods, fiber-rich carbohydrates, healthy fats, and appropriate protein can support better blood glucose control. Regular physical activity helps the body use glucose more effectively and is an important part of diabetes prevention and management. For people who are overweight or have obesity, achieving even modest sustainable weight loss can improve metabolic health and reduce the risk of type 2 diabetes. Some people also need medication or insulin, and taking prescribed treatment correctly can help prevent long-term complications. You cannot change every risk factor, but healthy eating, regular activity, avoiding tobacco, and maintaining a healthy weight can help lower type 2 diabetes risk. If symptoms persist or you have significant risk factors, don't ignore them. Talk to a healthcare professional and consider appropriate testing. When diabetes is identified early and managed consistently, people can take important steps to protect their long-term health. Diabetes prevention and management aren't about perfection. They're about consistent choices, appropriate medical care, and understanding your own health. Diabetes isn't just about blood sugar. It's about protecting your heart, brain, kidneys, eyes, and your future health.